Hey everybody, I wanted to talk today about the research on using vagus nerve stimulation to address rheumatoid arthritis. This is an area that's been really fascinating to me for some time because just last summer, the FDA approved the use of the surgically implanted vagus nerve stimulation devices for the treatment of rheumatoid arthritis. And this first study I'm going to talk about is one of the main studies that prompted that decision by the FDA. So a lot of this research is being done by the Feinstein Institute. This study was 242 patients, and it was randomized, sham-controlled, double-blind, where the individuals were separated into two groups, the group that received the true vagus nerve stimulation and then the sham, and then they swapped them at the 12-week mark. They had moderate to severe rheumatoid arthritis. The main thing they were looking at is the main outcome measure is called the ACR 20, which is the American College of Rheumatology 20. And what this is it's a measure of improvement in tender and swollen joints of at least 20%. And there's some other things they're looking at in that as well. At the 12-week mark, the group that received the true vagus nerve stimulation, 35.2% of them had reached that ACR 20, so they had 20% improvement in their tender and swollen joints versus 24.2% of the sham group. Now, this was further improved at the 24-week mark. The other interesting thing about this study is that they saw less bony erosion in the individuals after receiving the true vagus nerve stimulation, and they saw this was more pronounced in those who had more inflammation at the start of the study. Now, they continued with this after the study was completed. The individuals still continued with their vagus nerve stimulation, and they were receiving 1 minute per day of the surgically implanted vagus nerve stimulation. So it's right on the nerve, so it's more powerful, right? And at the end of 12 months, there was a 60% average improvement in tender and swollen joint counts across the board, across all of the individuals in the study. So very cool. Now, what about non-invasive vagus nerve stimulation? This was a group, they did transcutaneous vagus nerve stimulation in 30 patients for 30 minutes a day for 12 weeks. And before they started the study, they had these patients stop their biological medications to see what would happen with just the vagus nerve stimulation. And they looked at the ACR 20, also the ACR 50, and the ACR 70. So ACR 50 means a 50% improvement, and ACR 70 means a 70% improvement. 16 of the 30 patients qualified for the ACR 20, 10 reached ACR 50, and 5 of them reached ACR 70. So that means 5 of the 30 patients had a 70% improvement in their tender and swollen joint counts by the end of that 12-week study. So amazing results again. Thank you so much for being here. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT. We'll see you soon.